Hello, TikTok, Facebook, all my family and friends, new follower that came across my page. It's Deshawn, and I have to apologize, you guys. Today is January the 18th, 2024, and I have not been checking in. I've been my spirits have not been as high, not the best, because of my legs. I've been having leg swelling. To me, it's been pretty severe. Almost kind of like I can't walk. Because they were swollen so bad and they were hurting, and I have been like in a bad place. Like, come on now, without your mobility, I can't do a lot of things. But I went to my doctor on Tuesday and they started me on some Lasix. If anybody know what Lasix is, it's a diuretic. It helps you urinate to get the fluid off. Even though I haven't been going to the restroom a lot, like, remind you, I'm RN. So when I give people Lasix, usually they start going like a lot, but I've noticed too with IV Lasix, they go sooner than by mouth, and of course mine is by mouth. But I'm feeling better, y'all. I don't feel like when I'm sitting still. I was feeling just tight, like my neck. Look at my face. My face is still a little chunky. My legs, my feet, toes, ankle, everything was just swollen. Even my arms and hands felt swollen. But I feel a little bit better. I did go to work last night. I didn't have a lot of swelling and generalized discomfort, but when I woke up this evening, my lower legs were swollen with some pitting edema. If anybody don't know what pitting edema is, when you press your skin and then it leaves a mark there. So it was like a +2 pitting edema, so I can go in 1, 2. But I've just eaten. I'm in bed. My legs are elevated, but I do feel a little bit better. I won't lie. I feel a little bit better. And I'm so thankful, so grateful. So yesterday, on the 17th, I had appointment to get my treatment. Since I'm done with chemo treatment, I still have to continue Progetta and Herceptin, which those treatments are particularly for HER2 positive markers. And I have to continue those treatments up until 18 months total, I think. Possibly not. It depends, And with those treatments, you have to get like an echocardiogram, MUGA scan. My insurance pays for a MUGA scan. So I have to get those every 3 months to make sure my heart, how my heart is working, check my ejection fraction. And I got that in December and everything was still stable. My doctor also ordered a CT scan on Tuesday to make sure I didn't have a pulmonary embolism, PE in my heart. And she checked me for any pleural effusion and pericardia. No fluid around my lungs, so she ordered me the Lasix. And I'm still waiting on my lab results because I asked her before she even ordered me the Lasix about my potassium, because my potassium runs on the lower side. I think it was like 3.5 or something on my last lab work, and it's 3.3. Below 3.3 is lower. And when your potassium is low, you can have some irregular heart rhythms, potassium and magnesium. So I don't see my lab results in my patient portal. And for some reason, the system they use does not update like my chart with Piedmont. So I'm still waiting on that. She also did a CT with the chest of my abdomen and pelvis. And she did not give me those results. She just gave me the chest because the most important thing was rooting out a PE, pericardial effusion, and pleural effusion. So I have an appointment on Tuesday. She wants to draw lab work just to see how my potassium is doing. And I guess we will address the pelvic and abdomen. Make sure there's nothing going on there. I had a 4-millimeter nodule in my right lung from this CT scan. But when I looked at my first CT scan, it was there as well, and it was unchanged. So, boy, I tell you, when you have a diagnosis of cancer, you're always looking. You're always scared that something else is gonna pop up. I also had a look at my nails. When I had my, what I have? I had a scan of my whole body. It wasn't a PET scan. It might have been the CT too. I had a thyroid nodule as well. It was like 2 millimeters or something very small, but still. In the future, what can it be? Because it wasn't there before. So y'all keep me in my prayers that this body is healed from anything that showed up on those scans. It's healed in the name of Jesus. Also, I think I told y'all last time that I was having some neuropathy in my feet, which still stands. So I'm on gabapentin for that. I'm supposed to take it 3 times a day, but I only take that 1 time a day because it does tend to make me sleepy, and there's no way I can function and taking those 3 times a day. I don't see how people take it 3 and 4 times a day. And mine is only 300 milligrams. Some people take 1,200, 800. Yeah, I'm a lightweight. So I've been taking those, just 1 at nighttime, and some Tylenol arthritis to help with my neuropathy in my feet. Yeah. And my doctor also told me that the swelling is pretty much, says it wasn't cardiac related. And I'm waiting on my kidney function to make sure my kidney function is okay. Since it wasn't cardiac related, that my swelling wasn't due to cardiac related issues, that it was from the carboplatin. So that is a side effect from the carboplatin. Was it a carboplatin? Yeah. And it'll take about 2 months for it to resolve. And that's her estimated time, about 2 months. But today I felt good, y'all. I did move around a little bit better. My legs are not as heavy. They're still a little wobbly. I still get a little short of breath walking upstairs and, walking around. I haven't been to my favorite place, Walmart, in months to walk around. Yeah. One day I got off work and I went to one closer to my job, which I've gone to before, and I know where everything is. I parked right at the door, went in and got what I needed. What I needed was right at the door. So I went in and got it and left out. But I love to walk around Walmart and probably spend unnecessary money. But that's okay. I think that's it. I'm eating, I'm drinking. I'm doing okay. Just trying to get these legs under control. And don't forget to like, subscribe, comment, share. Turn your bell notification on. And my surgery is set for January the 31st. And my next treatment for Herceptin and Perjeta is February 21st. All right. Thank you, guys. Have a good night. Bye-bye.